Okay, so the heart, the first thing we want to think about the heart is about its anatomy, where it's located, and then a little bit about its structure. It's located in the thoracic cavity. The space between the two lungs is referred to as the mediastinum. There's more than just the heart in the mediastinum, but that's where this is. So the dotted line in this picture basically outlines all of the mediastinum, and the heart is really just this part down at the bottom here. Some sources might have the upper limit of the mediastinum in a slightly different position, but that's not terribly important. Passing through the mediastinum, you're also going to have the trachea, which we can see exposed here. The major blood vessels, which we'll talk about today, that are connected to the heart. And posterior to the trachea, which we don't see in this picture here, is the esophagus, which is pointed out here. This pen and ink drawing shows the lateral view, and what this shows is the heart here in the front. The aorta comes out and arches over, and the trachea and esophagus basically go between them. The trachea ends where it branches into the bronchi going into the lungs, so we don't really see it past this level right here. But the esophagus continues on posterior to the heart, but anterior to the descending aorta there. And one of the things you're going to do today is to look at the heart models, some of which are over here. And these big ones, which are often kind of scary to students because they look old and they're kind of falling apart, are really good actually because they demonstrate that. We can see the trachea branching in the bronchi here in the esophagus, with the aorta arching over both of those. And that's the only heart model version that we have that shows those structures related to the position of the heart. Okay, I thought that it would be in here, but well, actually, let me move on for a second because I think the next thing I want to talk about is actually not the next part. So let me enlarge this picture again. Surrounding the heart, I kind of open it up twice, kind of suggested by this line going around it, is the pericardium. Now, the pericardium is the first of 3 examples of a serous membrane that we're going to talk about in this class. We're also going to see one related to the lungs and the respiratory system, and then related to the stomach and intestines and the digestive system. A serous membrane is a simple squamous epithelium and its associated areolar connective tissue that covers the outside of an organ and lines the inside of the cavity where that organ is found. The 2 layers are usually very close together, facing each other. The digestive system is a little bit different than that, but for the heart and the lungs, this is essentially true. The layer that's adjacent to the organ is called the visceral layer, and the layer that's lining the cavity where we find the organ is called the parietal layer. They're actually one continuous layer of tissue. It just sort of folds over where they come together. Some sources will have a rendition of this where there's like a balloon that gets wrapped around the outside of the hand. So imagine a mostly deflated balloon. That's an enclosed space. So the wall of the balloon would be like the membrane, and then there's some space within that balloon within the membrane. If you wrap that balloon around your hand, then there's 2 layers of balloon wall on the outside of your hand with a little space in between. That space in between, in regards to the heart, is the pericardial sac. It's filled with a fluid. The point of it is when your heart's beating, the fluid acts as a lubricant so that the heart isn't rubbing up against the surrounding organs and creating problems. What's going on in the lungs and digestive system is a little bit different, but they're the same kind of membrane. If you don't recall learning about that membrane back in A&P 1, I direct you to go back to the tissues chapter. In this book, they discuss the membranes actually at the beginning of the chapter. If you have the Martini book, I think it's at the end of the chapter, but it describes the different types of membranes, serous being one of those. I really thought that there was a picture of this in this book. Let me just jump ahead for a second. No, it's not there. Okay, maybe it's further down than I thought in this. Oh, okay, yeah. For whatever reason, the book actually presents this after some other stuff, which we'll get to in a second. But here we see a section of the wall of part of the heart, including the pericardium. The parietal layer is represented here by this kind of pink line, and the visceral layer is presented here. It's not quite the same color pink, but whatever. They're the same thing. They're just 2 layers of this one membrane that are basically folded over and facing each other. The apical surface of either simple squamous epithelium is facing into the pericardial cavity or the pericardial sac. The membrane secretes this fluid. It's called a serous fluid that fills that space there. And then we have the other one on the other side here. Beyond the parietal pericardium, or more of the parietal pericardium, is this fibrous layer. This is a dense irregular connective tissue, which basically surrounds everything and kind of anchors it in place. The picture I was showing you a second ago, down at the bottom where the heart kind of runs up against the diaphragm here, all of these little lines are actually suggesting some of that fibrous pericardium acting again as an anchor to hold the whole heart in place. Okay. They don't quite point out that way or label it that way, but that's really where all these lines are. There's all this fibrous tissue that's the fibrous pericardium as it's attaching to the diaphragm. Now, the visceral layer of the pericardium is actually also considered the outermost layer of the actual heart. And so the label here actually says epicardium, and in parentheses it says visceral layer of the pericardium. So that simple squamous epithelium and its associated areolar connective tissue is the outermost layer of the heart. Then as we go deep to that, the next layer, which is all of this kind of red colored area here, is the myocardium. It is essentially cardiac muscle tissue, although it also has some connective tissues in it to help hold it together, very similar to connective tissues that we saw in skeletal muscle, like the endomysium and perimysium and that kind of stuff, holding it together. We don't have quite the same layers, but there's connective tissue in there holding everything together. And then the innermost layer is the endocardium, which is another simple squamous epithelium and its associated connective tissue, areolar connective tissue. In this case, it's not 2 layers, it's just lining the inside of the heart, and it's continuous with the lining of the blood vessels. When it's in the heart, we call it the endocardium, as that same simple squamous epithelium extends into the blood vessels, we call that the endothelium. But it makes for sort of one continuous, smooth lining to the whole system. So what I just skipped over there, so I was talking about the position of the heart up above here, and then I jumped down here to talk about the layers of the heart wall, which kind of really follows that pericardium thing. Then the next thing I want to cover, which is what I jumped over here, is somewhat summarized in this picture, which we'll get to in a second. But then also after this, we're looking at the surface of the heart and some other structures here, and then down an internal surface picture of the heart. This kind of gets at these different things. Now, just want to open up a blank sheet so I can do a little bit of writing here. What I want to kind of concentrate on for the anatomy of the heart, and what the other pictures that I started to point out are, and I'm going to get to show you a bit more, is that in the heart we're going to see 4 chambers, okay, 1, 2, 3, 4, and 4 vessels, or major vessels, blood vessels, that is, 1, 2, 3, 4, and then 4 valves. Okay. So basically these 12 things make up the major anatomy of the heart that we want to get to know. And also in looking at them, we'll get a feel for how the blood is pumped through the heart and therefore through the cardiovascular system. The chambers, there are 2 upper chambers or superior chambers and 2 lower or inferior chambers. The superior ones are called atria, the inferior ones are called ventricles. And then there are 2 on the right and 2 on the left. So that makes up sort of this 4-square thing. So we have the right atrium and the right ventricle, and then the left atrium and the left ventricle. Now, I could certainly have said the right atrium, right atrium, left atrium, right ventricle, left ventricle, but I put it in this order specifically because it has to do with the way that the blood moves through the heart, which we'll see in a little while. The major blood vessels, the things that are bringing blood to the heart and carrying blood away from the heart, we have the vena cava, or cava, however you want to pronounce it. There's an inferior and a superior one of each of those. They bring blood from the body back to the heart and connect to the right atrium. The inferior vena cava is bringing blood from the lower body, anything inferior to the heart, and then the superior vena cava is bringing stuff back from the upper body, anything superior to the heart. Okay. It is essentially the big vein, which is not exactly what vena cava means, but it's the biggest vein in your body. And then we have the pulmonary artery, or I should say pulmonary trunk, which splits eventually into the pulmonary arteries, a left and a right one. What does pulmonary refer to?
Lungs.
Lungs. So these are the arteries that go from the heart to the lungs. And they're pumping the blood that's come back from the body through the vena cava out. So the trunk is the one thing that emerges out of the right side of the heart, specifically from the right ventricle. And then it splits right and left to carry half the blood to the one lung and half the blood to the other lung. And then we have the pulmonary veins, which are just carrying the blood back from the lungs to the heart. They connect to the left atrium, which is just the next stage in moving of the blood. And then from the left atrium, blood goes to the left ventricle, and then that pumps the blood out into the aorta, which then carries it all back to the body. So I set those things up kind of to follow the direction that blood moves through the system. Right? Blood returns from the body through the vena cava to the right atrium, and then it goes into the right ventricle, where it's then pumped to the lungs through the pulmonary trunk into the pulmonary arteries. The pulmonary veins return that blood from the lungs after it's picked up fresh oxygen to the left atrium, and then blood goes to the left ventricle, which pumps the blood out through the aorta back to the body. If we look at, not that picture, this picture here, we can see these players. So here's the superior vena cava and the inferior vena cava, which are connecting to the right atrium that we see here. And then from the right atrium, the blood goes to the right ventricle, which pumps it out into the pulmonary trunk, which splits into the right and left components. And then coming back from the lungs, the blood travels through the pulmonary veins. There are two on the left and two on the right over here, and they connect to the left atrium. And then blood goes down into the left ventricle, which then pumps the blood out through the aorta. Now, the colors that are represented in this picture are essentially getting at the color of the blood inside those blood vessels. Blue represents deoxygenated blood. Deoxygenated blood isn't actually blue, but that's the color that we use by convention. And then red represents the oxygenated blood. A lot of people are in the habit of thinking of veins as being blue and arteries as being red. That's not exactly true, because the color is really about what the blood is inside the vessel. Now, these two side by side, the vena cava and the aorta, they are colored that way. The vena cava carries deoxygenated blood back from the body, so it's blue, and the aorta is carrying oxygenated blood back out to the body, so it's red. Together, they represent the return and output through what we call the systemic circulation, the blood vessels going through all of the body. And for that, the blood is always red, oxygenated in the arteries, and always blue, deoxygenated in the veins. And that's really where that convention comes from. If you think of red arteries and blue veins, it's the systemic circulation. And in fact, when we look at the blood vessels, we're really going to be looking at the systemic circulation. So that color coding will kind of carry over. Just keep in mind, it's really about the color of the blood in there. Arteries are really just blood vessels that carry blood away from the heart. And you can remember that because artery and away both start with the letter A. And veins are carrying blood back to the heart. So keeping that in mind, the pulmonary arteries and pulmonary veins are colored backwards from what people are used to, because the right side of the heart is pumping deoxygenated blood away from the heart to the lungs through the arteries, and then the oxygenated blood coming back from the heart, coming back from the lungs, goes to the heart through the pulmonary veins. When we look at blood vessels, we're actually not going to look at the pulmonary circulation at all. The reason I do that is so that when we think pulmonary circulation, we just think pulmonary artery, pulmonary veins. We're not going to talk about any specific vessels in the lungs that have different names. So you can just remember the blood vessel has pulmonary in its name, the arteries are blue and the veins are red. Otherwise, systemic circulation, arteries are red, veins are blue, reflecting the state of the oxygenation state of the blood in that vessel. So I just want to take a second to look at this picture to talk about those structures after writing all that down here. Then I want to go and add to this growing list the valves. I took a break there because the way I want to present the valves is a little bit different. There are two types of valves. There are the atrioventricular valves, which are abbreviated AV for atrioventricular. And there are two of those. And there are the semilunar valves, abbreviated SL, though I don't really use the abbreviation myself. And there are two of those. Atrioventricular is referring to something between an atrium and a ventricle. So the AV valves are between the atria and the ventricles. On the right side, that's the tricuspid valve. And on the left side, that's the mitral valve, which is sometimes referred to as the bicuspid valve. Now, it might sound like we're calling the tricuspid valve because there's something important about it having three cusps. In fact, that's not that special. All valves have three cusps except for the mitral valve, which is also sometimes referred to as the bicuspid valve. It's just tricuspid was used to describe that particular valve, name that particular valve. But all other valves have three cusps also, except for this one other valve that we've listed here. The semilunar valves are between a ventricle and an artery. And they're always named for the artery that they're connected to, always, as if there's a bunch of them. There's only two. On the right side, that means we have the pulmonary valve, and on the left side, we have the aortic valve. So what I've done here is a little different because I wanted to talk about AV versus semilunar valves. So I didn't follow the pathway that the blood's taking. Okay? So if we include all of this in together, there, I've got everything on the same page. Cut off the title, four chambers, but deoxygenated blood returning from the body, coming from the vena cava, inferior, superior, goes into the right atrium. There's no valve between a valve and an atrium. Oh, sorry, there's no valve between a vein and an atrium. So it just drains right into that. And then the right atrioventricular valve, the tricuspid valve, is between the right atrium and the right ventricle. The point of a valve is to make sure that blood moves in one direction only. So this ensures that blood goes from the atrium into the ventricle and not the other way around. There are conditions where valves don't do their jobs properly, but ideally that's how they work. And then the right ventricle is separated from the pulmonary trunk by the pulmonary valve, the semilunar valve on that side. When the right ventricle contracts, it pumps the blood through that valve into the pulmonary trunk, which will then go through the pulmonary arteries into the lungs. And then returning from the lungs, blood travels through the pulmonary veins to the left atrium. Again, no valve separating those. And then from the left atrium to the left ventricle, blood moves through the mitral valve. And then the left ventricle pumps blood through the aortic valve into the aorta. Okay. So the first two lists are actually lined up in the order that blood's moving through things. For the valves, since I separated them out based on AV versus semilunar valves, it really should be tricuspid, pulmonary, mitral, aortic to follow the pathway of the blood, but I didn't set it up that way. Now, going back to this picture here, the AV valve we see here and here, the tricuspid on the right side, the bicuspid or mitral valve on the left side. And then the semilunar valves we see here, the pulmonary valve going into the pulmonary arteries and the aortic valve going into the aorta. There's something obviously different about the AV valves from the semilunar valves in their shape, which is the edges or the cusps of the AV valves are attached to the wall of the ventricles by these tendinous cords. And the Latin term that means tendinous cord is cordi tendini. And where they're attached to the muscle, these little bumps of muscle here, actually the label's on the other side, right? Yeah, are called papillary muscles. When the ventricular wall contracts, those papillary muscles contract also, and they pull
the tendinous cords taut. That actually helps the valve stay closed. And there's not really a picture to express that too well in the book. Let me see. There's an image that sometimes I can find on Google. This is half of the image I want right here, but not the important half. Oh, come on. There's not a good representation that I want here. Let me go to this picture here to kind of give you a little idea. So this is just an inset showing a representation of the mitral valve here. The cusps of the mitral valve are represented here. And then the chordae tendineae are basically attached at the edge to these papillary muscles. Blood will move from the atrium through the valve into the ventricle. And as it fills up the ventricle, the blood's going to fill up basically on either side. And there will be more blood outside on the edges of the valve than would be filling back this way. So it'll push the cusps of the valve closed. The pressure is going to build up in the ventricle as the ventricle starts to contract. And there's a possibility that that pressure is going to push on the valve so much that it'll blow it back the other direction. And so the tendinous cords that are attached anchor the cusps in place so that they don't blow back out that other way. Just going through a few of these other pictures. This one might kind of make the point as best as I can hope. So as blood's kind of pushing against the cusps of the valve to close it, these cords are being pulled tight by the contracting muscle, and it basically anchors the cusps down so that they can't be blown back out the other direction. When that happens, that's a condition called mitral valve prolapse, where little blood shoots back the other direction, which is not what you want to have happen with a valve. So hopefully that's a fair explanation of what the chordae tendineae are about. The semilunar valves don't have that. They don't need that. The reason why there are chordae tendineae is that the pressure within the ventricles builds very rapidly from almost zero to well, eventually in normal situations, about 120 millimeters of mercury worth of pressure. And if that pressure is pushing back this way, it could certainly blow the valve back and blood will be pumped the wrong direction. So the chordae tendineae hold that in place. That's not necessary across the semilunar valves because the pressure differential across the valve never gets that drastic. It's usually the higher pressures on the opposite side, so there's not the risk of blowing it back out. So it's not as big of a deal. But they're visibly different when you're looking at them like that. I kind of went past this picture a little bit, or I didn't come back to it. This sort of summarizes the direction that blood's moving through everything. So you can follow the arrows through the right side, which is all colored blue for deoxygenated blood, and then the left side, which is all colored red for the oxygenated blood. And you can see how everything moves through. The picture down below represents the two circuits as we describe them. The heart pumps blood to the lungs and it comes back from the lungs. We call that the pulmonary circuit. And the blood pumps, the heart pumps blood out to the body, either upper body or lower body, and it comes back. That's what we call the systemic circuit. So there's a systemic circuit where arteries are carrying oxygenated red blood out to the body, and veins are carrying deoxygenated blue blood back to the heart. And then the pulmonary circuit, which is the heart pumping blood to the lungs, and it comes back, and their arteries are blue, veins are red. So we see the two sort of circuits of the circulation there, which is what this is getting to. This little box here just shows a few defects in this overall heart anatomy where things don't quite work the way they're supposed to. This is an interesting picture I've seen a lot of places. We're basically looking down mostly from an superior view with the atria removed and the arteries removed, so we can see the location of these valves. One thing you can see is that the tricuspid valve and both semilunar valves, in fact, do have 3 cusps each, and the mitral valve has 2. Also, what you can see is the pulmonary valve sits directly in front of or anterior to the aortic valve. So in a picture like this, you wouldn't really see the aortic valve here. It technically is sitting directly posterior to the pulmonary valve. But in these two-dimensional pictures in an anatomy book, they're always going to represent them that way so you can see where it should be. But really, it's behind it. Here's with the AV valves open. Here's with the pulmonary valves open. That's probably it. Oh, coronary circulation. I will talk about the coronary circulation actually when we talk about the blood vessels next week, partly in the interest of time and partly because we're talking about blood vessels next week. Yeah, so that's the end of that part of the chapter. So the next section in the chapter goes on to look at the electrical activity in the heart and how the heart coordinates the events of the cardiac cycle, not cardiac cycle, but heartbeat. And then the cardiac cycle describes a little bit more what's happening within that heartbeat, and it goes on a little bit more. So depending on exactly where time goes today, I might barely get into the cardiac cycle stuff. We'll see how that goes, but there's that. Now, I'm going to stop here. This isn't exactly, well, this is going to count for break time. We're not going to go through till, 10 till 7 and take a break there, exactly halfway through. Because what I want to do is take a break or stop presenting information here and give you a chance to look at the heart models and get a feel for the structure of the heart and the three-dimensional anatomy there. So I have 4 heart models over here on this card, which I got from next door, and there are 3 heart models back there that were from that open cabinet down there. So there's a total of 7 heart models, and there certainly are a lot more than 7 of you here. So what I want to do is take time for you to look at the heart models and get to know them a little bit. And pay attention to three-dimensional anatomy, where things are actually located relative to each other. And think about the direction that the blood's moving through the heart as it's pumping. So I've kind of talked about that aspect of things. And there's this, this picture right here that I talked about, okay? Just the direction of blood flow through everything there. So think about these 12 things, the 4 chambers, the 4 major vessels, and the 4 valves in terms of how the heart's pumping the blood. Right? I said earlier there are these big heart models that are sometimes a little bit off-putting to students because they're look kind of old and that sort of thing. One thing that makes them kind of off-putting is that pieces seem to be kind of falling off of them. So for instance,
there's this piece that's the wall of the right atrium. This little wire thing is supposed to hold it in place, but the spring mechanism is broken, so it doesn't really work, and this thing falls off pretty easily. But you can see into the right atrium. But I really like these models because, one, they're so big, they have a lot of good detail on them, and two, they point out some interesting and useful things. One thing you're going to be looking for is the valve. So the AV valves are pretty obvious. They have this kind of plasticky looking thing representing the chordae tendineae. I just took the anterior wall of the heart off so we can look into the right ventricle. And it might seem kind of strange that there's no pulmonary valve right there. I just want to point out on these heart models, the pulmonary valve is actually part of the heart, the wall piece. You can see the pre-cusped structure here from the superior view. And also you can see that they have kind of a half moon shape, which is where semilunar comes from. There's one big piece that covers the left side of the heart, which is here. So you pull this off, and you can see the left atrium and the mitral valve and the left ventricle and the aortic valve there. Half of the mitral valve is on the wall piece, so you can kind of see those things. One thing I don't really like about this model is the color choices they made. Try not to let things fall off here. So here we have the vena cava, superior, inferior, and those are pretty blue, and we can see some, not pretty like, oh, what a pretty blue. But they are fairly blue, as are the veins here on the coronary circulation. But then when we get into the right atrium and the pulmonary trunk here, it's not really blue, it's more of a purple. I wish they were more consistent with the color there. For whatever reason, they decided not to be. And then coming back on the left side, we can see the two right pulmonary veins on this side and the two left pulmonary veins on this side. They're purple. They should be nice and red. That's the most oxygenated blood possible. That's the blood that's just coming back from the lungs. So that should be the brightest red imaginable. And it should be the color of the aorta that you see there. So the color choices here are a little bit unusual, distracting, whatever. The smaller parts that we have, this slightly larger one has better color representations, maybe. It's a little more modern and a little harder, easier for students to get their hands on, whatever you want to say. We have one up here. There's one of these back there. There's also one smaller heart model from next door. There's not one of this size back there, which is why there's 4 here and 3 here. This just has one big piece that takes all of the front off, and you can see that. Now, we actually have 2 more heart models that people can use to look at. Here in the torso models, if you take the lungs off, so these 2, not the big guy here, you can get another little heart model. Here you can take the front piece off and look at that. And this, of course, is going to be life-size. All of these other ones are bigger than real life. So really, we have 9 heart models within the room. There's still more than 9 of you here, but at least that's enough probably for everybody to be able to look at the hearts. I want to just close out this section real quick with one thing, and it'll take me a second to pull it up. Which is this YouTube clip. This is from Happy Days.
The right atrium's where the process begins, where the CO2 blood enters the heart. Fluid contact down to the right ventricle, pulmonary artery and lungs. Once inside the lungs, it dumps its carbon dioxide, substance oxygen supply. Then it's back to the heart through the pulmonary vein to the atrium and left ventricle. aortic valves where the blood leaves the heart and extends to the rest of the body. The arteries, the arterioles, and capillaries too bring the oxygenated blood to the cells. Tissues in the cells get off waste CO2, which is carried to the vessels and the veins. The blood then examined to the atrium and lungs, and that's where we started in the heart.
Okay, so we're not going to watch Tom Hanks fight the Fonz there, but so there used to be a longer clip that had more of the show in there, which actually set up the whole piece. And what it is that the gang has left high school and they're in college now at the University of Western Wisconsin or wherever they are. And Potsy's, you know, even before the clip that used to be here, Potsy's talking with the Fonz, saying how he's failing A&P and he needs to figure out a way to be more successful. And the Fonz says, well, use what you know. And so Potsy's a musician. He writes this song to help him remember the circulatory system. And then he gets 100% on his test, and the crotchety old professor doesn't believe that he could have done that. He must have cheated. And so the Fonz walks in to intimidate the professor, and spontaneity ensues, and everybody starts singing the song for him, which obviously the professor got a big kick out of. It's kind of a silly little clip, but it goes there. If you recognize that song, you most likely recognize it because it's used in the St. Joseph's aspirin commercial, or it was several years ago. And it's really only one of the two verses there, but it kind of goes through there. If you really thought that was a catchy tune, feel free to go on YouTube and listen to it a few more times. There is a version here that has the lyrics going by, so if you want to look at that a little bit more in depth, feel free. But I'll leave you with that. So you're kind of thinking about that. And again, this is ostensibly the break time for the night.